Welcome to ACI's YouTube channel, and our special topic today is mental health issues. After the tragic shooting in Washington, D.C., there are many questions to be answered, much confusion. The issue today is mental health, and I'm Ann Clark, CEO of ACI Specialty Benefits. And with me is Rafael Cortina, our clinical manager, to discuss mental health issues, both what happened in DC and what happens in your organization if a person exhibits serious mental problems and treatment approaches. Rafael, people are talking about the availability of mental health services, and yet it's my experience that all states have laws which allow the police or really anyone to take custody and institutionalize a person exhibiting psychotic behavior. First, what is psychotic behavior?
Well, psychotic behavior is when an individual is experiencing symptoms that appear to be disconnected from the reality or the reality that most of us perceive. It could be paranoid ideations. They believe that there's somebody who's trying to hurt them or threaten them.
He was said to have accosted strangers and accused them of talking to him and listening to him. He was hearing voices.
Correct.
In the hotel. And so this detachment from reality is key.
Yes.
Now, other people have said that he was devout, that he was a nice guy, he was a funny guy. Mm-hmm. But it's not a whole picture. It seems to me that we need to single out the psychotic behavior and let the other behavior go, because when a person is hearing voices, they need help.
Correct. And I think that's a great point, because rarely do we see someone that it's completely lost in their psychosis. That's a severe state of psychosis. There's a lot of people who are able to function, who are able to be social, but they have those paranoid thoughts, those fears, those ideas that they're hearing voices, that there's people after them. That I agree. That's the concern. Mm-hmm. They might be able to function, have a job sometimes, and be very well liked, but they're still having those issues that are threatening and concerning and affecting their well-being.
So we have an employer who may or may not have used the employee assistance program. Mm-hmm. In our organization, if we heard from a manager, we would recommend that the police or in some places there are mental health teams. Correct. That will actually take custody of the person. How does that work, Rafael?
Yes, definitely. Whenever there is a concern for somebody's safety, either the individual's or someone else's, the immediate step to take is safety. A lot of times people are concerned if this is going to be embarrassing for the person or is it overreaction. But unfortunately, we could see that there's not such a thing as an underreaction or overreaction when it comes to mental health. So what would happen is that they will not be arrested or harassed by the police. What happens is that the police officer or trained professional will come and talk to an individual, get an idea on what's going on, and they have the power legally to place that individual on a hold and take them to a psychiatric facility where they will receive treatment. They will be under observation, they will be reviewed for medication, and make sure as much as possible that they're getting their needs met and their psychological or mental illness addressed.
So at any point in this process, I've been hearing mixed reports, and of course we're only going by the news, but people knew he was hearing voices, people knew he was unhappy at times, strangers were accosted, hotel employees were asked to find him because he was unstable, and yet there doesn't seem to be any record of an attempt to take him into custody for his own benefit.
Exactly. And I think anybody at any point has the capability of calling the local police department
and responsibility.
Yes, definitely. It's not, and sometimes we fear upsetting someone, and I think in these cases like this, and this is a tragic, horrible example, that we need to do as best as possible, especially people who are in a management position, to make sure that the person's getting the help that they need for the protection of themselves and others.
So I would say all states have a law, like in California it's
Correct.
called 5150.
Correct.
All states have this capability,
Yes,
including Washington, D.C.
definitely.
Okay, so when this person might have been taken into custody, with psychotic behavior, the treatment generally is drugs
Correct.
and antipsychotic drugs, and then a recommendation for therapy.
Yes.
So is that just in a theoretical situation, if you had been involved in this case, how would you have handled it?
I think the very first thing would be to have a full psychiatric assessment and have the person begin medication treatment. One of the common challenges, especially with psychotic disorders, is they tend to be non-compliant with medication. It's part of
Yes.
their delusions that either they think they're not sick or they think that the medication is trying to harm them in some way or another. But what we also know is that after being on the medication for a significant amount of time, they start getting better. Some of those symptoms start to decrease. And there's a lot of clients and a lot of patients that realize, I'm doing better with the medication. The voices are less intense, I'm less paranoid, but it takes time. So the best recommendation is, one, to be started on medication, and once they're out of the hospital, they have follow through to make sure that they're seeing a psychiatrist, they're seeing a therapist. Sometimes they need even more intensive programs like partial hospitalization.
And family would be important here, an employer knowing what is going on. Proper releases could be signed.
Correct.
So that the employer would not fire the person, in fact legally could not fire the person, but be involved in watching for the return of these breaks
Yes.
with reality, these psychotic symptoms.
Definitely. One thing that the employer can request, and of course every company has their own policies, but it's very common that you could request a fit for duty letter where you could actually get a letter from a psychologist or a psychiatrist saying this person is able and ready to return to work, or if they're not and they need to be placed on disability.
So the key here is not being too nice, and not being afraid that this is going to be some kind of CSI incident in
Correct.
which he's handcuffed and manhandled, and this person is going to be taken into custody, possibly by a mental health team,
Correct.
and then held for 48 hours to be observed and medicated where indicated.
Yes.
And then an attempt would be made to sign proper releases so that the family, the employer, and those around the person could create a supportive team
Correct.
to monitor for the return of these behaviors
Yes.
and symptoms.
Yeah, and even though the person might not see it as help, that's what we're doing. We're giving them the opportunity to access services, to access help, and we're actually helping them by contacting them with the authorities that could take care of them when they can't.
Good. So a shameless plug for ACI's Employee Assistance Program. If you're an employer and you have an employee who is exhibiting bizarre behaviors or breaks with reality, such as been described by Mr. Cortina, that is a person who needs to be referred to the EAP. And if any violence is suggested, referred immediately to the police and or a mental health team. This will be a healthy process for the individual involved. They will not be penalized on their job or in any other way, but rather to get help and prevent the tragic violence that might occur when someone has a complete break with reality.
Yes.
Thank you so much for joining us this afternoon. And any questions, you'll see information on the screen for our 800 number and other social media ways of contacting ACI Specialty Benefits. Thank you.